Your Excellency Dr. Yohannes Chala, Head of Addis Ababa City Administration, Health Bureau, Your Excellency Dr. Sisa Yirgu, Provost of St. Paul's Hospital Millennium Medical College, Dear Excellency Scott Hockland, USAID Mission Director, Your Excellencies and all representatives, Dr. Patrick Abok, country representing the WHO office, our representatives from CDC, Dr. Biniam, and Dr. Lucia, who's not yet with us, but has promised to be with us from Stop TB Partnership representative, Your Excellency Ato Ahmed Mohammed, GLRA country representatives, Excellency Professor Afor Kasu, our TRAC chairperson, and also our DG of AHRI, dear TRAC members, regional health bureau heads, former and also recent participants and leaders in research and leading research and TB in our country, our researchers, guests, and esteemed colleagues. It's with great pleasure that I extend my warm welcome to all participants to this 18th Research TB Annual Conference. On behalf of the Federal Ministry of Health, I'm really honored to inaugurate this 18th Annual Conference. But as we know that TRAC has been very instrumental in shaping our TB research agendas, and not only bringing research, but also changing the policies and the strategies that we set for our country. We know that Ethiopia has been one of the highest pathfinders but one of the countries with high TB burden. But we know that we have been very instrumental and we have seen a lot of change in the past few years. If we try to see the change that we have really achieved in the past, especially before the goal we set in 2020, we have really achieved tremendous achievements with reduction of our incidence in TB. The reduction from 2050 to 2020 has been very much significant. Of course, reductions are not made. You know that there has been a reduction of around 31.3% reduction in incidence from 2015 to 2020. And there has been a reduction of morbidity, but also mortality significantly, which is around 34.6% when we compare our data that we had in 2015 to 2020. Why I really focus on that target is our country was really successful in bringing and achieving the states and the goals that we set for 2020. But did we stop there? No, because as you know, look at how many days we have in the country. As we speak now, before we finish 24 hours, we still have 54 days accounted for TB. And we're still having cases, we're having stigma, and there is still some discrimination. There has been a lot of improvement, but we're still facing cases of discrimination. And there are still areas that we wanted to improve in the cases and the care that we want to do for eliminating TB. The country has set several targets in the next 7 years. And we are also aligning our targets not only in 10 years now, or not only in 7 years, but also changing our targets every year. But mostly now we have almost left with 7 years. But our targets are ambitious, but we know that with the support we have with everyone, the support of our partners, continued partnership we have with all implementing partners that have been delivering their keynote speech in here, but mostly our clients, our patients, our community, our healthcare professionals, who are always trying to find a way to set the day to say that we have achieved ending TB, has been set in the next 7 years. There has been a tremendous effort, and there also has been a lot of achievement that we have seen in reduction of the TB burden, and Ethiopia has been one of the instruments in setting some of the global agendas and sharing our resources of the evidences that we got from the TRAC and the research that we have achieved and the implementations that we had in the country over the past, at least, for example, the 18 TRAC conferences that we had. But this is also a time that we have to say, where are we implementing our research and how are we going to intensify our efforts? Because the ambitious target that we have in the next 7 years, we all have to be for accountable. The government has tried to put, as you have heard, my colleague, Dr. Yohannes, has been saying that the country has also started to intensify in research labs through the support of all the partners that we have in here, but also our partners that we have from the region. I also want to use this opportunity to say thank you and welcome to this beautiful town in Addis, but our partners in the region from all the other corners in Africa, but our partners who are also part of this initiative to really end TB and ending TB by 2030. So this is a crucial time that we have to intensify the efforts we have, bring back evidences, making ourselves accountable for the evidences that we have, but implementing everything as that reaches into patient-centered and client-centered approach that we want to do in TB, not only in TB, but diseases that we want to eliminate by 2030. We have also set a target for leprosy. We have set several targets for other lung diseases, and the ministry is trying to see whatever amount of time and whatever amount of resources that we have to match. You have heard earlier that we wanted to match, and we are also, the government is trying to put all efforts to match what other partners are putting to end the TB incidents and the TB pandemics that we have in the country. So I want to use this opportunity to say that we are really grateful, the country is grateful, but we still need to have match our gaps and reduce our burden of ending TB. So using this opportunity, I want to say that in the past few years, especially since 2022, we know that since the past almost 4 years now, since COVID, it's not just TB, but the challenge that we have in the country are putting the efforts that we want to eliminate or achieve the targets has been challenged, especially in areas that we had conflict and we are still having conflict. Areas to reach into our clients is still affected. Though we have evidences that we discuss in here and that we will continue to discuss in here, we also have to find ways of innovation, ways of innovative approach that meets to the needs of our clients, the needs of our population. And we have to intensify and highlight areas that has been a lesson that we take. What has been a lesson that we take from COVID? What are the lessons that we want to take from the impacts that the conflict and the war that we're having are putting on our clients and our people? And because we have also seen that there has been a highly alarming amount of cases that we see, especially the trend has been a little bit worsened, especially around the year 2022. So this is also an early sign that we have to intensify on the things that we have started to go back due to the impacts that we had with the COVID conflict and a changing climate. I want to also stress the changing climate. There has been a good trend, as we all remember, when COVID hit, because everyone was wearing masks. There has been a change in habit. So we have to use all the lessons that we took from that achievement, a little bit reduction in infectious diseases, including TB, but coupled with the change that we see in climate and the global change that we see throughout, not only in our country, but the globe and the region, we have to intensify our efforts. In the past few years, we know that we have, it has been presented also earlier, that the TB lab and the lab system we have in the country has started to expand, and our NRL, which is also at EPHI, where we speak now, where we're sitting in here, has been doing a lot of work for the country due to the support that we were having through USAID, our partners in WHO, CDC, all other countries, including the Milan, Italy reference labs, because they were also supportive and still continue to be supportive. Our partners in Uganda are also supporting in here. But we have to set our more targets now, that the labs that we have to be more accredited, and that accreditation has to be more speed up. So anything that is needed for making that accreditation, we would set at the country, at the ministry. I want to take this opportunity to say that we will put all efforts so that the standards we put are also up to the quality, to the nations we serve, but also to be an example for the region, that we're saying that the seat for the African Union is set in here. So finally, on behalf of the Federal Ministry of Health of Ethiopia, but also on behalf of myself, I want to take my former institute, but the former institute that I used to be serving, but I will continue to serve, St. Paul's Hospital Millennium Medical College, and also the Addis Ababa City Administration, all partners, the TRAC leadership. It's not an easy job to bring everyone together in here. in this beautiful way. And I want to use this opportunity to bring, to say thank you to the conference organizing committee, the dedicated team who are working behind that we don't see and hear at the front, and particularly our patients who are still keen to address the things that we are saying in here. The fact that we say we can end TB cannot be possible unless we have the community with us. So I want to say this, I want to take the opportunity to say thank you to the community and the public in general for the awareness they have, the efforts they want to put to work together with us in ending TB. Our healthcare professionals who are at the forefront fighting TB together with us, and everyone in here who take the time, and our partners who have set the time to sit with us in here to say how do we work and how do we end TB. And our researchers are putting their efforts to say this could be a way that we have to show to the country or all implementers and also inform policymakers, including us, to inform our works in the next few years, but particularly now, and ending TB. Thank you very much, and I wish you all a fruitful stay. Yes, we can end TB. Thank you so much.
Thank you so much, our Honorable Minister, Dr. Makdas. Now we move to, I shouldn't touch her speech. It's very crystal clear, and the Ministry of Health's direction is on TB control, and I hope definitely in our lifetime we will see ending TB. At least we may not eradicate TB bacteria in this globe because it is one of the resilient bacteria which stays across the human genome. Probably, some research findings identified from DNA fossil remnants of ancient people, and the DNA revealed that TB was there. So we may not eradicate the bacteria, but we can make it TB as non-public health important disease by the year 2030. That's the ultimate objective. And as you said, Madam Minister, our TB patients are the center of all deliberations of the TB program. And that is, and we should also alleviate the financial burden, the catastrophic cost. TB is not, as you said, a disease of medical care only. It's a disease of poverty, and it's a disease of family as well. I have cases in Jimma, I had cases in Gondar, I had cases in Addis even. TB patients are like the father, the elder son, the mother, and all wiped out by TB, one by one in a long period of time. So TB is a family disease, and that also puts families in a cycle of poverty. So that's why we have to work in collaboration with other sectors as well as partners together. Yes, together we can end the TB, and I hope I will see TB is a non-public health importance in our lifetime. Thank you very much. So, as I indicated before and announced by Mr. Scott, we have new project happening in Ethiopia. It was discussed in Awasa 3 years before, and continuous discussion among the technical teams and experts at the ministry and the USAID Ethiopia and USAID Washington. Then it becomes a fruitful discussion. Now it becomes a project, a new project with collaboration of the government of Ethiopia. So that announcement will be made by the senior advisor, Dr. Mukadi. He'll give us the project details, a brief project details, and we'll move on. Thank you very much, Dr. Mukadi, making all the way from Washington, D.C. Thank you very much.
Thank you very much, Fasih. Your Excellency, Dr. Megdis Daba, Minister of Health for the Federal Government of Ethiopia, distinguished guests and colleagues and valued partners, all protocol observed. You recall that last year during the UN high-level meeting in New York, USAID announced the Global TB Accelerator Plus. And one of the components of that Accelerator Plus, that is one way for us to show the commitment for the UNHLM. One of the components of that Global Accelerator Plan was called the Support Wide-Scale Intervention to Find TB, that we've been calling SWIFT TB. It's a program to provide additional funding to up to 2 countries. And then, as announced by our mission director, Scott, Ethiopia is one of the 2 countries that will partner with USAID to implement that program. We expect that the intervention under that program that is called the SWIFT TB will amplify existing efforts as well as achieve significant increase in detecting tuberculosis as well as drug-resistant tuberculosis, and reducing the gaps in the detections of tuberculosis. And then those elements fit quite well with our already targets that we've set up within our USAID strategy, which are aligned with the UNHLM target. And in order for us to close those gaps and increase TB case notification, we are expecting to see the program implement innovative approach and tools to increase TB detection. We've already started some of these projects, some of these elements in other countries. Some of the tools that we're thinking about introducing or expanding include the digital X-ray, which will be coupled with artificial intelligence computer-aided detection. By using those tools, we're also going to be increasing our detections of other comorbidities that we haven't really been managing in the past, but that are really also been seen with tuberculosis, such as cardiovascular diseases, pulmonary diseases, and other high-risk factors that are associated with TB that we haven't really managed. So we're also expecting to see a significant increase in the number of TB as well as drug-resistant TB detected. And one of the reasons why we expect to see an increase in drug-resistant TB is because we are going to be expanding the use of WHO-recommended rapid diagnostic test. So SWIFT TB is not just a funding opportunity for us, it's a call to action. And I hope that together with the Ethiopian government and all of our partners, we will utilize the resources to make significant strides toward achieving the ambitious target that we set up in the UNHLM. In closing remark, I'd like to extend our deepest gratitude to all our stakeholders, our tireless workers, the patients, as well as anyone that is working in the front line for addressing tuberculosis. USAID remains committed partners to Ethiopia in improving the health outcome of Ethiopian. Thank you very much.